Hello, I had a patient come in the other day taking citrulline. He was taking citrulline for various uses. One of them was erectile dysfunction. Now, the question is, what is citrulline? Why is it used? Where did it come from? Does it work? I'll go over all of those in just a minute, but a brief introduction. Brewer, PrevMed, heart attack, stroke, cancer, disability, dementia prevention. So citrulline is a non-essential amino acid. The kidneys convert citrulline to L-arginine, which is another amino acid. Remember, amino acids are used to make proteins. NO. What is NO? Nitric oxide. What is nitric oxide? We're going to talk about nitric oxide for just a few minutes because that appears to be the functional area, at least theoretically, for citrulline. Nitric oxide is critical to the intima or endothelial lining of the arteries. Citrulline, by the way, was named for watermelon, or Citrulus. It was first extracted from watermelon. Now, as I mentioned, nitric oxide, and therefore the intima layer of the arteries, is the critical concept here. There are three major layers of the arteries: the intima, the media, and the adventitia. We'll ignore the adventitia and just talk about the intima and media, mostly the intima. The intima is a slick, single cell, very thin lining. Doesn't provide any structural strength, but it provides a lot of metabolic advantages. The media provides the structural strength. And here's what happens with clot or plaque development. LDL, remember the bad cholesterol? When there are cracks in this intima layer, LDL can go through those cracks. If there's something like diabetes or periodontal disease, that LDL usually goes through the media as well. But again, with diabetes, periodontal disease, you get inflammation impact on this media as well. Things called proteoglycans form. The LDL can no longer go through the media, and it gets stuck in between the intima and the media. That may sound very confusing. Here's some pictures, real patients. So actually, these were patients that had died due to heart attack. So this is the cross-section of the artery, the media, muscle layer, the intima, that very thin layer that we're talking about with, again, nitric oxide is critical to the health of this layer. The more cracks you have in this layer, the more LDL, or bad cholesterol, can go through those cracks and gets lodged. If it can't pass on through the media layer, it gets lodged in between. That is plaque, LDL, which is migrated through. Now here's another concept. Our own immune system starts creating friendly fire for us, and it attacks that plaque. It releases enzymes that start liquefying that plaque. Here's the problem. That liquefied or inflamed plaque, hot plaque, if it breaks back through this intima layer, it'll cause a clot to be formed. That clot is what kills patients. 4 times out of 5, 19 times out of 20. Heart attack and stroke is caused by the clot, this black thing here, not the plaque itself. But that clot is caused by inflamed plaque that has broken back through the intima layer and touched the blood. That's, again, a heart attack, stroke, inflammation, cardiovascular inflammation 101. But again, I'm repeating it and going through it because of the importance of the intima layer and anything that improves the health of the intima layer, like nitric oxide. So again, this is all about nitric oxide. That's the major focus for citrulline. And we'll talk about more the connection in, again, just a few minutes. But for the biochemistry geeks out there, a molecular model. This molecular model is very similar to urea. Urea is it's actually part of the urea cycle. For those of you who are not biochemistry geeks, the urea cycle has a lot of uses within the body. One of the main ones being, that's how we take ammonia off of amino acids. Those of us eating too many proteins to excrete that ammonia in the urine. So now let's get a little bit more practical about citrulline. What do people use it for? Well, anything that's going to improve blood flow. So hypertension or high blood pressure, erectile dysfunction, diabetes, diabetic vascular injury. Again, diabetes creates its injury to the vessels by causing inflammation, which we saw some pictures of a few minutes ago. Weightlifters and bodybuilders use citrulline. Other athletes use citrulline. Again, many of you out there, whenever I do one of these videos on a supplement, I usually get a lot of reactions, a lot of passion around different supplements. And if you use citrulline, I'd love to hear your comments. Do you think, obviously you think it works if you're using it. Now, what does the scientific literature say? This one is enhancing cycling time. So this was a study looking at cyclists. To get to the punchline on this, I'll show a couple of things on it. Basically, this was a placebo, a randomized clinical trial. They gave some of the cyclists placebo and some of the cyclists citrulline. And sure enough, what they measured afterwards was nitric oxide. So at least in this randomized clinical trial, you did see an impact on nitric oxide after taking citrulline. So for those of you who are saying, well, citrulline doesn't actually impact nitric oxide, now there's, again, a lot of evidence in both directions here, but there's clearly some evidence that it does. Now here's the next question. Well, so what? Let's say you do get an increase in nitric oxide levels. Does it actually improve athletic performance? Well, this same study looked at time trials on the bicycles, the cycling time trial, and those who had citrulline finished far quicker. So again, some fairly good evidence. Again, as you look through the science, it's all over the waterfront. Can you say reliably that it works? Well, think about it. If you could, and if the evidence were overwhelming that it did, I think you'd see a lot more use for it. Do I think it works? I think yes, there's clearly evidence that it has worked and it works in certain situations. We just don't understand all the situations. And I think this is a good example. This is an editorial in medical sports science, and basically it's talking about citrulline. And it makes the comment here that yes, there's good evidence that it's worked in athletics, however, not always. In this editorial, they're talking about evidence in the scientific literature that it works and helps for athletes that are relatively untrained, but doesn't seem to help so much for athletes that are well-trained. Bottom line is, I don't think we know. Again, as I said, if you use L-citrulline, why don't you tell us, write in the comments below what you use it for. If you have some good references regarding science around L-citrulline, please share that with us. Thank you much.